Good day, welcome back to my YouTube channel. Don't forget to click subscribe for more updates. Thank you. 1. After an explosion at a factory, one of the employees approaches the nurse and says, "I am an unlicensed assistive personnel, UAP, at the local hospital. Which of these tasks should the nurse assign first to this worker who wants to help care for the wounded workers? A. Get temperatures. B. Take blood pressure. C. Palpate pulses. D. Check alertness." The correct answer is C. Palpate pulses. The heart rates would indicate if the client is in shock or has potential for shock. If the pulses could not be palpated, those clients would need to be seen first. 2. A client is diagnosed with methicillin-resistant staphylococcus aureus pneumonia, MRSA. What type of isolation is most appropriate for this client? A. Reverse. B. Airborne. C. Standard precautions. D. Contact. The correct answer is D. Contact. Contact precautions or body substance isolation (BSI) involves the use of barrier protection, e.g. gloves, mask, gown, or protective eyewear as appropriate whenever direct contact with any body fluid is expected. When determining the type of isolation to use, one must consider the mode of transmission. The hands of personnel continue to be the principal mode of transmission for methicillin-resistant Staphylococcus aureus, MRSA. Because the organism is limited to the sputum in this example, precautions are taken if contact with the patient's sputum is expected. A private room and contact precautions, along with good hand washing techniques, are the best defenses against the spread of MRSA pneumonia. 3. A newly admitted adult client has a diagnosis of hepatitis A. The charge nurse should reinforce to the staff members that the most significant routine infection control strategy, in addition to hand washing, is which of these? A. Place appropriate signs outside and inside the room. B. Use a mask with a shield if there is a risk of fluid splash. C. Wear a gown to change soiled linens from incontinence. D. Have gloves on while handling bedpans with feces. The correct answer is D. Have gloves on while handling bedpans with feces. The specific measure to prevent the spread of hepatitis A is careful handling and protection while working with fecal material. All of the other actions are correct but not the most significant specific approach used with hepatitis A. Question 4. The nurse is assigned to a client newly diagnosed with active tuberculosis. Which of these interventions would be a priority for the nurse to implement? A. Have the client cough into a tissue and dispose in a separate bag. B. Instruct the client to cover the mouth with a tissue when coughing. C. Reinforce that everyone should wash their hands before and after entering the room. D. Place client in a negative pressure private room and have all who enter the room use masks with shields. The correct answer is D. Place client in a negative pressure private room and have all who enter the room use masks with shields. A client with active tuberculosis should be hospitalized in a negative pressure room to prevent respiratory droplets from leaving the room when the door is opened. Tuberculosis (TB) is caused by spore-forming mycobacteria, more often Mycobacterium tuberculosis. In developed countries, the infection is airborne and is spread by inhalation of infected droplets. In underdeveloped countries, transmission also occurs by ingestion or by skin invasion, particularly when bovine TB is poorly controlled. Question 5. A nurse who is assigned to the emergency department needs to understand that gastric lavage is a priority in which situation? A. An infant who has been identified as suffering from botulism. B. A toddler who has eaten a number of ibuprofen tablets. C. A preschooler who has swallowed powdered plant food. D. A school-aged child who has taken a handful of vitamins. The correct answer is A. An infant who has been identified as suffering from botulism. C. Botulinum forms a toxin in improperly processed foods in anaerobic conditions. It is a neurotoxin that impairs autonomic and voluntary neurotransmission and causes muscular paralysis. Findings appear within 36 hours of ingestion. The nurse should be aware that all of these clients may be candidates for gastric lavage or for activated charcoal administration. Question 6. The parents of a toddler who is being treated for pesticide poisoning ask, why is activated charcoal used? What does it do? What is the nurse's best response? A. Activated charcoal decreases the body's absorption of the poison from the stomach. B. The charcoal absorbs the poison and forms a compound that doesn't hurt your child. C. This substance helps to get the poison out of the body through the gastrointestinal system. D. The action may bind or inactivate the toxins or irritants that are ingested by children and adults. The correct answer is B. The charcoal absorbs the poison and forms a compound that doesn't hurt your child. All of the options are correct responses. However, option B is most accurate information to answer the parents' questions about the use and action of activated charcoal. The language is appropriate for a parent's understanding. Question 7. Which of these nursing diagnoses, appropriate for elderly clients, would indicate the client is at greatest risk for falls? A. Sensory perceptual alterations related to decreased vision. B. Alteration in mobility related to fatigue. C. Impaired gas exchange related to retained secretions. D. Altered patterns of urinary elimination related to nocturia. The correct answer is D. Altered patterns of urinary elimination related to nocturia. Nocturia is especially problematic because many elders fall when they rush to reach the bathroom at night. They may be confused or not fully alert. Inadequate lighting can increase their chances of stumbling, and then they may fall over furniture or carpets. Question 8. A child is admitted to the pediatric unit with a diagnosis of suspected meningococcal meningitis. Which admission orders should the nurse implement first? A. Institute seizure precautions. B. Monitor neurologic status every hour. C. Place in respiratory secretion precautions. D. Cefotaxime IV 50 mg per kilogram per day divided Q6H. The correct answer is C. Place in respiratory secretion precautions. Meningococcal meningitis is a bacterial infection that can be communicated to others. The initial therapeutic management of acute bacterial meningitis includes respiratory secretions precautions, initiation of antimicrobial therapy, monitoring neurological status along with vital signs, instituting seizure precautions, and lastly maintaining optimum hydration. The first action for nurses to take is initiate any necessary precautions to protect themselves and others from possible infection. Viral meningitis usually does not require protective measures of isolation. Question 9. Several clients are admitted to an adult medical unit. For which client conditions would the nurse institute airborne precautions? A. Autoimmune deficiency syndrome, AIDS with cytomegalovirus, CMV. B. A positive purified protein derivative PPD test with an abnormal chest X-ray. C. A tentative diagnosis of viral pneumonia with productive brown sputum. D. Advanced carcinoma of the lung with hemoptysis. The correct answer is B. A positive purified protein derivative PPD test with an abnormal chest X-ray. The client who must be placed in airborne precautions is the client with these findings that suggest a suspicious tuberculin lesion. A sputum smear for acid-fast bacillus would be done next. CMV usually causes no signs or symptoms in children and adults with healthy immune systems. Good hand washing is recommended for CMV. When signs and symptoms do occur, they are often similar to those of mononucleosis, including sore throat, fever, muscle aches, and fatigue. Question 10. A client is scheduled to receive an oral solution of radioactive iodine, 131I. In order to reduce hazards, the priority information for the nurse to include in client teaching is which of these statements? A. In the initial 48 hours, avoid contact with children and pregnant women, and flush the commode twice after urination or defecation. B. Use disposable utensils for 2 days, and if vomiting occurs within 10 hours of the dose, do so in the toilet and flush it twice. C. Your family can use the same bathroom that you use without any special precautions. D. Drink plenty of water and empty your bladder often during the initial 3 days of therapy. The correct answer is A. In the initial 48 hours, avoid contact with children and pregnant women, and flush the commode twice after urination or defecation. The client's urine and saliva are radioactive for 24 hours after ingestion, and vomitus is radioactive for 6 to 8 hours. The client should drink 3 to 4 liters of fluid a day for the initial 48 hours to help remove the 131I from the body. Staff should limit contact with hospitalized clients to 30 minutes per day per person.